Good day, everyone, and welcome to our LabCoP extended echo session for today. Our sharing session from the LabCoP side is made possible given the funding support that we get from the Gates Foundation. My name is Francis Ochen, a project manager at the African Society for Laboratory Medicine. I am your moderator today. Our session will run for 1 hour. We'll take one presentation and get into the question and answers. We have language interpretation services. Kindly choose one of the 3 languages depending on which one is most appropriate for you. Our slides and recordings will be made available at the end of the session after, of course, doing the processing. And colleagues, today's session is focusing on really lab governance and how it is playing out on the continent. We are aware that good lab governance and leadership are so crucial in developing or delivering high quality lab services, and that also ensures ethical conduct and promotes effective resource allocation and utilization. So in today's session, we'll just focus on the ASLM's 2024 status report on lab leadership and governance in Africa. And additionally, we will also make available and discuss some of the proposed structured actions and considerations in a blueprint that is currently available and should support strengthening of lab networks on the continent through a very context adoption of the proposed considerations therein. Before I introduce our speaker for the day, we'll have just some few opening remarks from our Director of Programs. Our Director of Programs is Dr. Tokmo Maruta, and Dr. Tokmo, let me hand it over to you for some opening remarks.
Thank you very much, Francis. And team for organizing this very important extended echo session, as you have indicated. And let me take this opportunity on behalf of the African Society for Laboratory Medicine, welcome the participants that have joined us today on a very exciting session where we are going to receive the status report on the lab leadership in the continent. And then also, in addition, receive the blueprint, which also then provides the proposals for the way forward. In other words, what are the solutions to the issues that are being identified, that were identified and are being reported today on the status of leadership in the continent. Let me just quickly refer you back to the Lab Directors Forum, which is our platform that ASLM Africa CDC and the member states set up to bring together African continental leaders in the laboratory services. And when I looked at the core functions for this lab leadership forum, they include the following: 1, to be able to shape the laboratory agenda. In other words, detecting what should be discussed and how we should proceed when it comes to laboratory service provision in the continent. Also defining the priorities that we need to target in this ever-changing space in terms of funding, politics, social, economic, such that we can continue to strengthen the laboratory systems and network. And lastly, one of its core functions is to harness the individual capacities, individual capabilities and strengths amongst the member states. Now, when you look at these core functions, they really require a high profile of leadership skills as well as competencies in order that we can then be able to effectively, as leaders, lab leaders in the continent, as a lab fraternity in the continent, for us to effectively execute these functions, which are not just technical skills needed, but also soft skills when you look at leadership and management. You're looking at issues around, procurement, HR, and also just managing the lab networks that we are operating in. Now, at ASLM, we just in the final stages of finalizing our reviews on the available trainings that are there in the continent and also globally. We're looking at these skills that I've just spoken about. Are there opportunities to build this capacity within our lab leaders in the continent? And so far, the results that we are getting from the training programs that are available from just as short as 1 week to as long as 2 years, none of the trainings that we have so far reviewed adequately cover these soft skills that I've just spoken about. So the issue is there. The problem, as I have mentioned, the platforms to solve these problems are also not very adequate in order that we can adequately address them. So what is it that we need to do? We are very grateful for Lara, who has worked with the team from ASLM, worked with the leadership in the continent, worked with different stakeholders who have a role to play when it comes to lab leadership in the continent, trying to identify and define the actual problem and quantify it such that we can then be able to come up with solutions, which she will also present in the blueprint that she will present today. So we are quite excited about this. This, I think, report that we receive today will form the basis upon which we can then design Africa context-based solutions to be able to resolve this issue of lab leadership in the continent. So without wasting time, let me hand over back to the moderator to introduce Lara, who is going to take us through and share with us the report. We look forward to an exciting session, and please don't hesitate to continue to ask questions where you need clarifications. Thank you, and back to you, Francis.
Thank you very much, Dr. Maruta, and very exciting overview there in your opening remarks, and again also indicating some of the direction that ASLM and other continental players are already taking. Our colleagues, allow me now to introduce our presenter for the day, and our presenter is Dr. Lara Vojnov, and Lara is trained in virology and immunology. She worked for CHAI and WHO as the diagnostic advisor in the global HIV, hepatitis, and STI programs until 2023. And since then, she's now moved and she's working as an independent consultant, supporting multiple organizations, stakeholders, and entities in infectious disease and diagnostics, specializing in evidence generation and analysis, and also technical writing and policy development. So Lara, over to you for our session today.
Wonderful. Thank you so much, Francis and Talk More, for those introductions and kind words, but also just to ASLM in general for putting this effort together and conceiving the thinking around how to review and come up with some of the perhaps best actions to try to improve lab leadership in Africa. I think we're all quite excellent and solid on the technical pieces in the lab, but sometimes are not always well trained or not always well versed in some of those soft skills that Talk More touched on, and we'll touch on it quite a bit within this presentation. So just want to appreciate and thank ASLM. I think these pieces of work are incredibly timely for the continent, for countries to really be thinking about and trying to improve lab leadership. And that's not just necessarily the current and existing lab leaders, but of course the future lab leaders as well, and making sure that we create that sustainability in terms of some of those soft skills and concepts. So we'll go into those and feel free to ask questions. I may turn off my video just to be sure of bandwidth for yourselves and myself as we go. And let me share slides, and please let me know if you do not see these correctly. It worked earlier, but hopefully we're all set. So today I'll be talking, as mentioned, on laboratory leadership of the future in Africa, touching on both the status report, which really dug into what some of the issues were, as well as the blueprint, and trying to create a set of actions that might either preempt those issues or resolve those issues. And it was quite a collaborative effort, and so appreciating the number of stakeholders that contributed to this along the way. Within the status report, I'll touch on the methodology, the scope and coverage, the desk review, survey, and interviews that really led to the information that we gathered from the status report. And then in the blueprint, really highlight the framework concepts, the actions, and then some of the final key considerations, with the actions being the primary effort of that blueprint. So when we start looking into the status report, as highlighted by Francis and Talk More, the status report is now available actually on ASLM's website. And please take a look. You may have already reviewed it and seen it. And I believe the blueprint is shortly to be online, but I think Collins and Francis can provide us better insight on that. So when we look into and think about the methodology, we wanted to try to be as robust as possible in really looking to understand lab leadership in Africa. And in doing so, we took this mixed methods research and information gathering approach. We looked at a desk review, structured surveys, and key informant interviews, putting all of those together to try and triangulate the current status. We looked both at global, regional, and country level considerations. We analyzed over 40 documents, had nearly 30 interviews, including with some of you, I believe, in surveys, and then 14 in-depth interviews, both from the global, but primarily the country level. It was really an iterative process. We touched on the desk review that really helped to establish some of the themes and topics that we then incorporated within the survey to try and consolidate consensus on those themes and topics. Interviews really helped to refine some of the ideas and identify nuance. And for those of you who we interviewed, you probably got a sense that we were already trying to think about some of the associated solutions that we might want to think about. We focused the desk review and surveys to really, like I highlighted, try and emphasize the current status and problems, while the interviews did establish initially some of the potential solutions. Within the desk review, like I said, we had over 40 documents that were analyzed, but we looked at over 150 documents in general, both from country documents, normative documents, stakeholder documents, and academia and private sector, really trying to understand the considerations already provided in these documents to lab leadership. And again, we're really focused not on the technical considerations, not on how to establish an EQA program, for example, but on some of the soft skills that I'll touch on in a few slides around management, fundraising, budgeting, and those types of softer non-technical skills. So we looked at a wide variety of documents to try to understand that depth of consideration and inclusion of lab leadership. When we looked at not just documents, but also some of the surveys and interviews, we really targeted a subset of global stakeholders who all contributed to this methodology and to this process of gathering as much data as possible. And then on the right-hand side, really one of the key pieces of the methodology was the country level engagements. And you can see that a number of different countries, a significant amount of ASLM and LabCoP countries were engaged within this process, whether it was reviewing documents, responding to the survey, or being interviewed. And you can see the vast majority of those actually had multiple touch points within this process. And we want to make sure that that was the case to really triangulate the data and make this effort as clear and strong as possible. So some of the top line insights and primary outputs are listed here. And really one of the key pieces, and I imagine none of us are significantly surprised, is that there's a scarcity of data, research, and documentation on lab leadership, and on leadership in particular. So leadership, and I'm highlighting this here just briefly, is really focused around governance, management, and administration. So how the system perhaps is set up to really allow the lab to flourish, how you or your lab directors have been trained to manage a team, and how they've been set up to administer that team and administer the activities that have been laid out in any strategy documents. Unfortunately, those concepts are often overlooked, assumed, or only given tacit mention in key strategy documents. However, there are important initiatives underway to help capacity build for those core competencies. There's some best practices and lessons learned that we took from non-lab initiatives as well, that really rounded out the blueprint actions quite nicely. We felt like there's a unique opportunity to shape the conversation around this subject matter. And this really was a big effort within this piece of work to try to make that happen. So some of the desk review really confirmed the assumptions and brought down a set of themes and topics that were able to be used in the survey to try to understand a little bit more and dig into some of those key themes. When we look at them, these are really some of the core competencies, some of the skill sets that we'll be touching on quite a bit today. When we break it down into these three categories, leadership and governance, management and administration, and some key barriers. And what you'll notice, again, are some of these softer non-technical skills around whether there's strategic vision and planning, organizational leadership, the ability to critically think and make decisions, collaborate and engage stakeholders, and around ethics and integrity. Within management and administration, it's really some of the key points around coordination and oversight, laboratory and resource management, operational and technical management, communication and team management, and then policy and compliance. And then finally, around some of the consistent key barriers that we identified was around funding and financial issues, governance and institutional capacity, operational and technical challenges, and then finally, political and strategic alignment. And some of these are quite critical in thinking about how a lab can really be most successful. So when we looked at the survey, we had quite good representation from our lab leadership, as well as those perhaps that weren't lab directors, but were able to help navigate and better understand how the lab directorates were structured and what some of the lacking core competency skills were. Here you see that a good variety of the directors and lab leadership were responding to the survey at about 61%. We also had a number of managers and coordinators, and then some technical and operational colleagues, with the average experience in lab and diagnostics being 21 years, which is quite impressive and really helped us to better understand and dive into some of these data and really extract some very clear ways forward. When we look at the institution type, the majority were the public institution, with some in the international space or global space. There was a small set in the private sector. Academic institutions only made up about 3%. And then we had a few NGOs also representing. So really, the percentage of country respondents that were lab leaders was quite significant, of which almost all of them were lab leaders currently. But we did have a couple of responses from previous lab leaders, which was quite insightful. When we start digging into some of the results, immediately it was relatively clear, as you can see on the left-hand slide here, that, well, it's very positive that almost 80% of countries of respondents have a formal national lab directorate in place with a clear mandate. You can see that 21% don't. And so there's clear differences in the maturity of where countries are in terms of lab leadership, mandate, and competencies. When you think about some of the ratings of the current NLD or National Lab Directorate ability, you see that there's quite a difference between how countries responded themselves versus how global partners may have responded. The scale is relatively short, as you'll see, so the difference isn't too significant. but countries certainly felt very confident in their abilities in leadership and governance, as well as management and administration. That said, this scale was out of 5, and so it was very clear that countries still felt like there was a gap that needed to be addressed. When you look at how the respondents thought about some of these core skills, it was quite interesting that we found that what was some of the most important, identified as some of the most important skills, were also those that respondents identified as being the weakest core skills. So you can look, for example, at lab and resource management, coordination and oversight, were often found as some of those skills that were weakest but most necessary, like strategic vision and organizational leadership. And so understanding that was very helpful in trying to be able to frame some of those solutions. When again, we think about, that the structure, NLD structure, the mandate was something that was consistently observed. The lack of professionalization of the lab profession, either within training, out of service training, as well as in service training, as well as the lack of associations, the lack of training on how to fundraise, how to budget programs, how to advocate and speak the lab language, but in a very perhaps layperson way, so that those outside of the lab space could understand. Those skills were typically not part of either out of service or in service training, and tended to come up repeatedly in terms of the needs for some of the lab leadership to improve. And so when we start thinking about some of the 4 key pillars that came out of this effort, were around structure and mandate. Again, this is going back to in some cases, the lack of a national lab director at structure or mandate. And even for those countries that did have those, they often may have had multiple steps or multiple personnel before they could talk to the permanent secretary or even the Minister of Health. When we look at perhaps guidance and agendas, we have a number of declarations or resolutions, but they don't necessarily provide the how-to. And so really trying to enable external NLDs and empower that maturation. When we look at the core competencies, again, these are around skill sets, both soft and hard in leadership and management, around being able to communicate effectively outside of the lab space. Sometimes we tend to go quite deep talking about EQA, talking about viral load, and sometimes it's helpful to be able to learn how to speak a language that can be compelling, whether it's to leadership in the country or to funders, to clarify why lab is so important. And I will say, at least on a wide global scale, we haven't always done a great job of that, and that was one of the key pieces. Or, for example, making sure that we're in the room when key funding decisions are being made, whether it's from donors or other spaces. And then finally, around advocacy and voice. And again, really enabling both internal and external, what some of those enablers might be to promote maturation of your NLDs and your voice to be able to command a clear audience and highlight the importance of the lab space for the entire public health system that you have in your country. And so we really dug into the status report and some of those outputs. And there were the description of the current status. Like I said, this is now published and on the website, really identified the problems. And now we're shifting into the blueprint. So what is the proposal for the way forward? And what are some of the solutions? And again, I believe that should be published shortly if it hasn't been already, but I'll leave that to Collins and Francis to share the status there. So let's dig into the blueprint already and what some of these solutions might be. And we wanted to think about it in a broader context and framework. Of course, you have in green here the National Lab Directorate or its equivalent, but there are also a number of spaces that interact with the NLD, both in a bigger context, so institutionally within the whole country, and then as we have here, for example, we're all affiliated with ASLM or the Africa CDC in that regional or global context. Then we, of course, generally often see subunits of the National Lab Directorate and the lab network. And so when we break down what some of the core competencies are, there is this governance focus. When national lab directorates are formed, that often is driven by the national government. And so there's that governance focus and making sure the structure works for the country and for the National Lab Directorate. And it goes both ways, of course. Then we have those leadership considerations. So the lab directorate needs to be empowered with the skill sets to lead a national lab. And again, that involves both interaction above their position as well as below their position to make sure they're leading their staff clearly and well. And of course, managing and administrating some of those core competencies for a smooth NLD. So based on the findings from the status report, we set up effectively 5 key action-oriented domains. And this looked at first the structure of the National Lab Directorate, the strategy of the National Lab, making sure that we touched on actions that would improve the core competencies, again, not just of the National Lab Directorate or director, but also the staff within the National Lab, professionalization of the lab in countries, and then advocacy. And we'll touch on the actions in each of those 5 domains, but altogether from these, we had 29 actions with perhaps some of the proposed leads being included within each. But we won't focus on the latter piece, just on the actions primarily today. So when we first start looking at the structure, there are 5 proposed actions to try to improve the structure of the national labs. First is considering an assessment tool, so trying to understand where different countries are in terms of their structure and mandate for their National Lab Directorate. Of course, as I touched on before, some don't even have one. And so that is a fairly clear element, but helping to understand the maturity of others will be quite useful to then have, whether it's ASLM or Africa CDC, to develop a set of what are perhaps ideal structures, mandates, roles, and responsibilities for the National Lab Directorates, and ideally endorse a set of these ideal situations. And these could be considered on a regional basis. We know, and it was quite clear, that some regions had somewhat of different setups of their National Lab Directorate for reasons. And so we may want to think about how to consider that set of ideal NLD examples, perhaps. And then ideally, it would be around providing documentation of the examples of model National Lab Directorates, ideally with costing and budgeting included, to encourage South-to-South learning and being able to support any countries that might want to adapt their model to one of these model ones, seeing the benefits of those likely for their national lab. The 4th action is around including best practices, particularly for subunits, and on often neglected functions, which we've seen quite a bit. Then finally, encouraging national lab directorates to deepen their leadership and management capacity building in team. So sometimes we have seen high turnover or some turnover of the lab directorate with limited training or capacity building for a potential replacement or within the team. That's not ideal, if that lab director happens to leave their post, as then the whole team is effectively having to start again. In this case, we're really encouraging how to make sure that leadership and management are core pieces of training for a variety of players within the National Lab. And ideally that a deputy director is also identified so that there's a little bit more sustainability and consistency if there is movement in the leadership space in the National Lab. When we move over to strategy, there are 7 proposed actions here. The first one is around national lab directorates to establish and update national policies and strategies. Again, this isn't always necessarily focused specifically on the technical, but also making sure that the priorities are clearly delineated and expanded upon for what the lab wants to do as it relates to the public health response in the country. Ideally, it would be lovely to have these an online repository where you can all review and share your national policies and strategies to be able to learn from each other and perhaps adapt and expand upon your own based on what you might see in others. And then ideally having, whether it's ASLM or Africa CDC or both, to support with inclusion of often overlooked macro topics. And we can go into more detail on that if that's useful. The second action is around consolidating and developing lay summaries of historic and recent declarations. We've had quite a number in the lab space. But sometimes those perhaps are a little bit technical or could be beneficial for countries to really understand and leverage those declarations and resolutions within their country, and trying to provide some of the support there is quite useful. The next action is around national lab directorates publishing their policy, strategy, and planning documents. And again, having that online repository, even if it's closed within ASLM or within countries, may promote and support some of the South-to-South learning that we've seen flourish so well within the ASLM space. The fourth action is making sure that for countries that don't yet have technical working groups, to establish those, or perhaps to strengthen the existing technical working groups that support national lab directorates. And again, this would be mostly in strategy development and planning, less so perhaps on the technical considerations, but ensuring that the lab is strategically placed, has key activities that will support the public health response, the national public health response, and in planning their strategies for the future. The fifth action here is around supporting the reforms for each of the country outlined in the Lusaka agenda. Then including donors and partners in some of those technical working groups. We thought this might help to make sure that the lab space was also able to be sitting in some of those key decision-making sessions as well when funding discussions are happening. And ideally, having that back and forth would do so. Then finally, declarations, resolutions, and calls to action should be led and driven by country needs, and ideally would be enforced, funded, implemented, and operationalized based on those country needs that are laid out. Under core competencies, and this is one of the most critical pieces we felt like, there were 7 proposed actions. First one, and I know Talkmore touched on this, is looking into and encouraging capacity building programs that avoid dilution of leadership and management skills. Sometimes when we've seen trainings happen, they may touch a little bit on strategy and policy, or a little bit on fundraising or budgeting, but then they quickly move towards the technical elements. And of course, we're all technical people. We all understand that space quite well and are comfortable there. But a good capacity building program really highlights and focuses on the leadership and management skills. And these skills should ideally be able to help all of us, whether we're in the lab space or in another space altogether. So they're not necessarily technical, and they're not necessarily very lab focused. The second action would be to promote and endorse any existing competency frameworks that can be identified to include all of those skills that we feel are most critical for our national lab directorates to hold. And I know Talkmore just mentioned they've been doing a robust review of those. And ideally, we start to see a program being established that can really help us to build that framework. The third, for any of the existing competency frameworks that we really think about considering, is to evaluate the impact and content of them in the African setting. Ideally, it would be if one of those existing competency frameworks were to be used, ideally it would be adapted and endorsed in an African-focused competency framework. Again, these skill sets can be translated across professions, across regions, but in some cases, it's very likely that there would be very beneficial to have a regional-based, focused competency framework for some of these softer skills. And action number 4 would really be to encourage a full cohort model of a competency framework. But on the other side, and we heard this quite a bit from surveys, from interviews, etc., is really thinking about perhaps a modular approach. Not everyone can necessarily sit through 200 hours over 2 years of a program, and perhaps have some of the skill sets that already are being touched on within that framework, but would really benefit from being able to maximize perhaps some of the modules specifically to really round out their skill sets. And so having a more flexible approach to a framework would be beneficial. Number 5 is around developing incentives for completing competency frameworks. When I learned about some of the different existing competency frameworks, it felt like some of those were at the robustness and level of effort that you sometimes see in a master's degree program. But you only really walked away with maybe a certificate that you've completed something. And so ensuring that there's, perhaps you might call it an incentive, but it's really a reward for completing what can be very robust trainings. And so being able to, again, have that flexibility to think about how perhaps some of the academic institutions can be engaged in completion of those frameworks. Then we have, within those frameworks, there is often mentorship considerations. However, we did feel like it would be valuable to also develop a multi-year practical mentorship model within, but also beyond any competency framework and training. So for example, something where having a mentor, and this could be a variety of different opportunities for mentor, both regionally from the private sector or globally perhaps, where you could reach out to them and say, how does this funding pitch sound to you? What would I improve there? Or I'm challenged in developing a budget presently with and fulfilling what I need. Can you review it and take a look for me? And really being able to basically have a mentor in place to support that effort. And then finally, fundraising and financial management are key components of the National Lab Directorate, but are, again, typically not skills that any of us have learned within any PhD program, within any lab system program. And so ideally, not just having those within a core competency framework, but also perhaps having ASLM or Africa CDC engage a resource mobilization effort that countries can leverage, can speak to say, I'm looking for X and Y funding opportunity. Can you support me with that? But also support developing the proposals, learning how to develop strong proposals, and that's part of the communication and advocacy we'll touch on a little bit, to be successful. You know, this is almost a profession in and of itself, and so having you know, the lab directors as relatively technical people do this as well as the myriad of other functions can be quite challenging. And so being able to have someone to support or someone to lean on to execute some of the fundraising and financial considerations could be really valuable. Then finally, or not finally, the last two. The first one is around professionalization. And we spoke to this quite a bit when a number of us, and I think a number of you all, joined in Abidjan, was how to highlight and ensure that the lab space was as professional as perhaps the medical doctor space in countries and others. And so the first action here is around compiling and sharing successful lab-related professional associations in Africa, providing guidance on how to develop that, and effectively encouraging formation. Also promoting development of master's degrees, doctoral programs, and medical residencies for people in the lab space, promoting positions for lab professors and faculty, so effectively lab people are training lab people as opposed to perhaps pharmacists or medical doctors, obviously complementing as well. And then develop a pitch book for countries as they need to have that when they speak to either their academic institution or their leadership. And then finally, reinforce and promote the role of research labs. Research labs can have quite an impact on a country, whether it's publishing strong data, fundraising and bringing in funding for research, et cetera. And so engaging with research laboratories within the space and promoting their role is something that was identified by a few colleagues. The third action is creating a set of generic career pathways that then each country can look at, review, revise, and adapt for their own settings. And then national lab directors can contextualize those career pathways and effectively develop talent plans. So those who are quite young in this space, who are still in a master's or doctoral program, really see a path forward. And then, of course, those of us who have been in the space for quite a while can think about and consider shifting or really, you know, where we may want to go on that pathway. And then finally, creating advocacy materials for donors to promote really this sector-wide professionalization of the lab. And then finally, when we look at advocacy, this one's really quite important because it's about how we as lab people can advocate for our space, advocate for the importance of the lab. And that obviously then has a knock-on effect in terms of being able to get fundraising funds in order to be prioritized perhaps by the national governments, et cetera. So the first action is really thinking about hiring an expert in advocacy, communication, economics, and/or health informatics. And in that space, you know, they could develop generic materials around why is a lab important? How can a lab support a country's strategy and priorities? And being able to put it in language that perhaps a permanent secretary or a minister of health really wants to hear. Sometimes when we talk, we can talk about, well, you know, the turnaround time was very quick, or we had a very low error rate, but those aren't necessarily always the most catchy considerations for a permanent secretary or a minister of health. And so having someone who can sort of speak both languages and prepare some generic materials in that case would be useful. Second, provide practical training to the national lab directorates and support for adapting that suite of tools that perhaps the expert could create and supporting them to adapt it for their settings, for their needs, for any next strategy conversations they might be having, et cetera, and be there as effectively a mentor in those spaces as they need. Ideally, availing delegations from respected regional entities and having those direct conversations with Africa CDC, with the WHO, with the WHO Afro, and other key regional entities to ensure lab is part of their key strategies. The fourth action here is around promoting development of high-level products. So that's engaging in regular discourse, again, with key regional and global political bodies to ensure that the lab priorities are a part of some of those key resolutions and key declarations that might be coming out in the future. Or effectively, if there's new goals perhaps that UNAIDS is developing, that we're able to speak that language to clarify the importance of why perhaps some lab components should be considered. Number 5 is around ensuring advocacy efforts for laboratory priorities are given ample consideration in funding proposals. So how can we have that conversation within our national government or perhaps with partners to make sure that some of those priorities are considered and are funded appropriately in any future proposals. And then ideally, and this is more towards donors and partners, is around increasing coordination to really align funding opportunities with country priorities. And we kind of lighten this language, but really what we're trying to suggest here is that countries start owning and developing their own priorities and then bringing in donors and partners to fund those different priorities and opportunities. That it now starts with the country really leading the process, especially and including in the lab, with then understanding and laying out how they might fund those different priorities, as opposed to perhaps what maybe used to happen more often, where donors and partners came into country and said that we want to support this, even if it wasn't perhaps a priority by the country or the lab. And so really starting to take that ownership, and it goes back to some of those first strategy actions around really developing your clear priorities and strategies, and then linking it here with aligning the funding opportunities with those priorities. So now just touching on the last slide, we wanted to include some of the key considerations. And of course, all of the countries are in different maturities and strengths of their mandates. And so some of these actions may be more relevant and less relevant to others. Of course, again, the National Lab Directorates, we want to take them into context. There's different structures as well. And so that likely impacts, some of these actions you may feel already are likely far more valuable than others. And that's an important takeaway and thing to start thinking about within your countries. There are, of course, different domains and different actions for different levels of the healthcare system. These aren't just for the National Lab Directorate. Some are for the governance above, and some are for that management piece within the National Lab Directorates. There are a lot of upstream and downstream considerations, of course, and we touched on some of those. And fine-tuning is certainly needed for some of those actions to target, and at what time over the next few years. We really thought about how we can create some efficiencies within some of these actions, and that's with some of the more standardized documentation. But ideally, that's just putting together an initial framework that then would be adapted and varied for each of the different countries, depending on where you are, your context, your structure, et cetera. And so there should be a recognition of a variety of options that are available for each of the different countries, again, depending on your maturity, mandate, context, et cetera. But covers ideally some of the diverse domains that are really needed in that set of soft and hard skills that are not those technical foci that we often have. And then finally, provide some flexibility for a variety of different costing scenarios. Again, ideally, countries leading their agendas, their priorities, and their strategies, and finding ways to cost a number of those activities based on what their needs are. So I'm going to pause there, hand it back to Francis, and really open things up for any questions and discussion. Thank you so much.
Excellent. Excellent, and a very great summary there of the work that you've done, Lara, with ASLM and other partners. Of course, you've indicated, and very competently, the scarce documentation on issues related to lab leadership and governance on the continent, but also the governance tools that need to be really documented and kept up to date. And our practices should actually speak to whatever it is that is documented in those governance documents, call them policies, strategies, and plans. But also consideration for either strengthening or establishing new lab and national lab directorates with clear really pathways, because we know for now that some parts of the continent do not have, some parts have, of course, in different shapes and capacities. And so we now then need to walk through the proposed blueprint and see what then applies to each country and be able to support them to do that. We have barely 7 minutes to deal with some few questions, and colleagues, keep those questions coming. We'll deal with those that we can within here, but also those that we cannot, we will deal with them outside the session and make those responses available to you. We have a few questions that have come through, and I will start with one from a colleague who sent it directly to me. And Lara, what was your definition of a national lab directorate? Because, well, you've spoken to the equivalent, but also the national lab directorates, because this participant is seeing that countries are overscoring themselves, and those who are looking from outside are underscoring, and we don't know who is picking to which definition of a national lab directorate. So what is your definition, and would you then encourage going forward that the global entities that are out there should define this so that then we weigh ourselves against the same criteria?
So that's a great question. And we tried to highlight that in the status report as a clarification of terms, because I think whoever asked the question, you're quite right that there probably is no one definition of a national lab directorate. The way that we effectively defined it was referring to the entity in charge of lab networks at the national level. This may typically, but not exclusively, be related to lab services for diagnostics. Often it's not a standalone directorate per se. In a lot of countries, we understood that it wasn't really it wasn't always designated as a directorate. It might have been a department, a program, a subunit of another directorate in the Ministry of Health. But we tried to define it as sort of that kind of equivalent in countries, a little bit more generically. But it brings up a great point that exactly that. There isn't necessarily a great definition that exists already. And there isn't great consistency across countries in terms of developing that national lab directorate, or where it sits, or having it be its own standalone directorate. Francis, I would say to your second question, I might, instead of suggesting that a global entity develops that definition and that clarity, why shouldn't that perhaps be something that, at least for the African continent, that ASLM, Africa CDC do with support from countries? What African countries define as their national lab directorate may not be the same as another region. And so perhaps that's something that could be helpful within that first set of actions under structure.
Great, and thank you very much, Lara, for that. So we have some comments coming through, but also additional questions. And I just want to read this comment coming in from Dr. Kingsley Odiabara from Nigeria. Is actually the immediate past director of the Federal Lab Directorate of Nigeria. And he's saying this is a very educative presentation, particularly for leadership of the National Lab Directorates. And of course, I'll add that even the new guys within the profession need to know this because they're going to be our next leaders. And his proposal is that the ministries of health out there should study the recommendations here and have them presented for adoption within their framework. That's a comment from Dr. Kingsley there, and I thought it was a great comment that I needed to speak to.
No, I agree. And I would just touch on, ideally, that's where some of the engagement with Africa CDC, particularly for some of the actions within the lab, but also in general, support that effort, like you said, Dr. Kingsley, to have those discussions with ministries of health and highlight where some of the key gaps and priorities lie that the ministries of health require focusing on.
Great. And there is a comment again that came through, and this is not a comment, but it's a question. So someone is asking Lara that is picking a few countries and reviewing their governance structure and applying the blueprint part of the scope of work of this work that you're doing?
I think that could be a really interesting idea. It's not necessarily part of this existing scope of work. But as we were developing these materials, certainly there was the thought of, could we execute all of these actions in a small set of countries and see what effectively happens? And ideally, we'd see some significant improvements in lab leadership. I think it's certainly worth thinking about with ASLM and others, whether we may want to try to see how that could move forward. It's a great idea.
Yes, and my colleague Charles, kindly check. There is a comment in French from Burundi. Please check, translate it, and put it for me in the chat so that we can pick that out. But before we do that, there is a question from Jean. And Dr. Jean is saying, what was the geographical distribution, regional distribution of respondents? And how were language and languages and subnational governance diversity managed in this assessment leading to this great report?
That's a great question. Apologies. And we look to include that in the status report. We effectively had some engagement from all countries in sub-Saharan Africa. And then there were probably half of the countries, primarily the LabCoP countries, where we had multiple engagements. And that included not just documents reviewed, but survey responses and interviews. Fortunately, within the team, we had colleagues who spoke perfect Portuguese, having lived in Mozambique for quite some time, as well as some who spoke excellent French, who I was able to lean on to make sure that we were able to translate any of the documents, survey responses, and have strong interviews with them. So we did aim to try and include that as much as possible, appreciating the need to do so.
Great, and I was waiting for Charles to do the translation of this comment or question from Emmanuel, but time is up on our side. And Lara, if you understand French, you could pick that and use it as part of your closing remarks. I'm giving you just about 30 seconds to do your closing remarks.
Thank you so much. So I just want to appreciate again the foresight from ASLM in really already starting to think about this important issue. I believe you started thinking about this mid last year or early last year, and it feels like in the current climate that this is the initiative that we all need to start developing independent, strong, sustainable national labs in countries where, again, countries are driving the agenda and engaging with stakeholders on the funding side, on the technical side, as you need and desire. And I think this is really such an important time to try to develop some of these the lab leadership processes and skill sets in order to move in that direction. And I'm really looking forward to seeing that happen and working with ASLM to move that forward. And again, just want to thank everyone for the opportunity to share all of the rich information that we were able to gather.
Thank you very much. And Emmanuel from Burundi, apologies. Your translation has just come through, but trust me, we will get back to you with responses to your comment, which is really passionately put with regard to what is happening in Burundi in terms of training specialized lab people, both from the technical arm and also the leadership and governance arm. So colleagues, we have reached almost the top of the hour, slightly after that, but great having Lara here sharing with us this very good work that has just gotten done, and we're getting to the blueprint, and as she's indicated, the blueprint too will be made available for countries to be able to pick what it is that they can. Be rest assured that if governance and leadership issues are sorted, then our labs will move those extra miles that we're currently struggling to move, because governance and leadership is really one of those key cornerstones in moving any entity. As long as it is done well, things will move. If it's not done well, then there will be the struggle that befalls every entity. So with those, and from us, ASLM, do have the best of your day, evening, or afternoon, depending on where you're joining us from. Also, do not forget, there is another session that is starting in about an hour for those who are interested in supply chain management related to genomics and genome sequencing and everything that happens in that corner. That session is running and starting in about just an hour or so. So with those, do have the best of your everything, and we'll see you either in the next 1 hour or in our next session that happens in about a week's time. Thank you very much.